Go.
Good day everyone, my name is Safaya Rajad Alvarez from DSN 212H and today I'm going to perform parenteral drug administration return demonstration using the subcutaneous, intramuscular, and intradermal injections. Parenteral drugs administration refers to any methods of administration other than oral means. The most common routes for parenteral administration include the intradermal, subcutaneous, and intramuscular and the intravenous routes. In performing medication administration, it is important to remember, observe, and perform the 10 rights of medication administration to ensure patient safety and ensure that we give our clients the most appropriate care. Prior to the procedure, first thing we need to do is to check the doctor's order on the patient's medication administration record. This is done to identify what kind of drug is to be given to the assigned patient, to identify the drug's name, the dosage, and the drug. The route of the administration and the time will be given. After doing that, we also have to check the label of the medication against the medication administration to ensure that we are going to prepare the right medication. In medication administration, it is important to perform the 3 checks. We'll have to check or read the label of the medication that is taken from the medication card. We'll have to read the label again before withdrawing the medication, and we'll have to read the label after withdrawing the medication. Now we will now proceed to the preparation of the materials to be used. This is to conserve time and energy. So the equipment is syringes. I have here a tuberculin syringe. I have my insulin syringe and a 5cc gauge, 23 syringe. Also have my aspirating needle, my hypodermic tray and a forceps, my alcohol, sterile water which will serve as medication for this medication, cotton balls soaked in 70% alcohol, and waste receptacles. And now I'll proceed with the preparation of the medication from a vials. So before I do that, I'm going to hand hygiene to observe appropriate infection prevention. So if the medication still need to be reconstituted, then the vials would contain the powdered form of the medication and a diluent must be added into that vial. After adding a diluent, we must mix it thoroughly by rubbing the vials between the palm of both hands. After doing that, I'm going to prepare the syringe. I have here the tuberculin syringe, ideal for skin testing and intradermal injection. I'm going to open it by the pocket. It is important to remember that we can only touch the barrel and the plunger of the syringe to avoid contaminating the needles. Now since this comes with a needle already, I'm going to loosen up first so that I can connect my tuberculin syringe into the aspirating needle. So now I'm going to open the aspirating needle. And then connect the needle into the barrel. Make sure to ensure that the connection isn't loose, and then I'm going to set it aside. Then I'm going to open the covering of the vial, and then the rubber seal is exposed, and now I'm going to clean it up using a cotton ball soaked in 70% alcohol. And clean into a circular motion. After that, I'm going to get my syringe and cut the syringe, and then I'm going to draw air into the syringe. The amount of air will be the equal amount of the medication that needs to be administered. And then I'm going to push the air into the vial. Pushing air into the vials will prevent vacuum from forming, and if you put too little air, then you will find it hard to draw out the medication. And if you put too much air, then the medication might be forced out of the syringe. So I'm going to insert this syringe and draw the exact amount of medication needed. After doing that, if you see an air bubble inside the syringe, then we can lightly tap the barrel to expel the air bubbles. And then I'm going to remove this aspirating needle. And then discard the aspirating needle in the waste receptacle to avoid needle prick injury. Now I'm going to connect the barrel to the appropriate needle size. I'm going to place this syringe with medication into a hypodermic tray, and I'm going to write the medication ticket so that we won't forget what medication it is, the dosage, and for who it is assigned. Now I'm going to proceed to the preparation of the medication in an ampule. What I'm going to do is prepare my syringe. So I have my 5cc gauge 23 syringe here for my intramuscular injection. I'm now going to open package, and since my syringe comes into a needle, I'm going to loosen it first so that I can connect it into an aspirating needle. So an aspirating needle will help to reduce the risk of having glass inside into the medication. So I'm going to connect my syringe into the aspirating needle and make sure that the connection isn't loose. Okay, I'm going to sit it down first. So with an ampule, what we want to do is afflict the upper stem of the ampule couple of times first. After doing that, we're going to get gauze or cotton balls. Hold the cotton balls between fingers and the neck of the ampule, then break the ampules away from you and away from other people just for caution. After doing that, discard the broken neck of the ampule, set it down, then then we're going to get our syringe, then draw out the medication. Cut ko lang.
Kodlog eh.
Unsa man na di ay. I got something. Pinag si Heidi ni ba?
Kawa ka mo. Hindi mo siya
Hindi siya mag-up.
Ingana na. Ingana na.
I-aspirate daw.
Dili, ingana dyan na. Pares na usahay sa, garaa. Na dugay siya mo up. Nama siya amigod. Na siya masulod pero gagmay lang.
Hiwad daw, mahuwad siya.
Dili.
Pwede man siya maana. Hindi siya mayabong. Pero sige lang, tama.
Pag hinay taon anak eh.
Oo, anak, tama.
Ano, ayun ako. Sige na.
Ilabay na.
Laban.
Yan na ilabay. Yan na ilabay. Isabay na lang na niya. Apila na rin.
Pag ano sa pagkukuha sa dyan.
Oh. Gago ni Huwi, lagi mo needle.
Gani inong.
Sige, gina. 1, 2, 3. Basa.
Now I'm going to recap the needle and take off the aspirating needle off and discard. And connect the syringe into the right size needle. I'm going to place this into a hypodermic tray and then write the medication ticket. Now I'm going to perform the subcutaneous medication administration. Subcutaneous administration is the introduction of the small amount of solution into the adipose tissue beneath the skin by means of syringe and needles. After preparing the medication, head over to the patient's room, introduce yourself to the patient, verify the patient's identity, and explain the procedure to the patient to ensure the patient's privacy.